Good afternoon, everybody. My name is Adriana Hopkins. I am your moderator for today's webinar. I want to say thank you so much for taking time out of your day to join us for Black and Rare Sarcoidosis in African American Women. You will hear from clinicians and patients to get a full understanding of this rare disease and how it affects people. I do want to point out that while this disease may be rare, its impact is great for those suffering with delayed diagnosis, financial burdens presented, and quality of life changes. We do appreciate you being here because with knowledge comes empathy, and hopefully we can work to bring awareness and research dollars to these rare diseases. I want to turn things over right now to Kenita Seeley, who is with the Black Women's Health Imperative and the Rare Disease Diversity Coalition. Kenita?
Thank you, Adriana. Good afternoon. My name is Kenita Seeley. I'm Policy Counsel for the Black Women's Health Imperative. On behalf of the Rare Disease Diversity Coalition, I would like to welcome you to today's webinar event, Black and Rare Sarcoidosis in Black Women. The Rare Disease Diversity Coalition was formed to address the challenges that marginalized populations face when seeking a diagnosis and accessing treatment for rare diseases. Spearheaded by the Black Women's Health Imperative and comprised of a group of rare disease experts, healthcare nonprofits, patient advocacy groups, and industry experts, the RDDC aims to educate and empower rare disease patients of color, reduce the time between the onset of symptoms and diagnosis, and eliminate racial bias. Throughout the next hour, you will hear from expert panelists who will discuss the clinical knowledge that has been gathered around sarcoidosis, its high incidence rates in African American communities, in particular among African American women, and strategies to raise awareness and mobilize stakeholders so that patients living with this rare disease receive more support. We are excited to partner with the Foundation for Sarcoidosis Research for this event, and will now hear from their CEO, Mary McGowan.
Hello, I'm Mary McGowan, CEO of the Foundation for Sarcoidosis Research, also known as FSR. Sarcoidosis is a rare immunological disease characterized by the creation of tiny clumps of cells that cause inflammation in one or more organs of the body. When too many of these clumps form, they can interfere with an organ's function, leading to serious and sometimes fatal complications. Sarcoidosis affects roughly 200,000 Americans, and over 90% of those living with sarcoidosis have lung involvement. African American women are highest prevalence from developing sarcoidosis and highest risk of complications and even death. FSR is dedicated to improving these statistics and has launched the first of its kind African American Women and Sarcoidosis National Campaign to raise awareness among patients and clinicians. This campaign, Ignore No More African American Women and Sarcoidosis, is already receiving national attention and serves as an important building block to bring about meaningful change. The patient is at the center of everything that we do at FSR. With this in mind, we put out a call for applications in order to form our Women of Color Patient Advisory Committee. In just 2 short weeks, we received applications from over 70 women interested in participating in this campaign and outreach. Through a rigorous application and interview process, we selected 15 members to serve on this committee. The committee is charged with providing insight and ideas for the design, development, and messaging of all educational materials associated with this campaign. Additionally, the committee members have received extensive training to allow them to serve as ambassadors for this program and spokeswomen who catalyze change and progress. You will hear from 3 of these amazing committee members today. Their stories are powerful, moving, and bring home the challenges faced by so many African American women living with this complex rare disease. Though we could not have all the individuals who expressed interest in serving on this committee to serve on the committee, we are proud to share that the remaining applicants have been integrated into our commanding group of patient advocates and are playing an instrumental role in driving outreach and engagement. We are also proud to have a passionate and dedicated Women of Color Clinical Advisory Committee. You will hear from one of its esteemed members, Dr. Divya Patel, during this webinar. Dr. Patel and other clinical advisory committee members take the discussion beyond providing statistics and helping to shape strategies and recommendations on how the clinicians, epidemiologists, and researchers can change the lives of African American women living with this disease through diagnoses, treatment management, empathy, and support. FSR is proud to partner with the Rare Disease Diversity Coalition to bring you this vitally important webinar on sarcoidosis. To learn more about African American women and sarcoidosis, please visit our website, stopsarcoidosis.org, and follow the hashtag #IgnoreNoMore on social media to follow the important work we do throughout this campaign. Thank you so very much.
And you heard Miss Mary McGowan there introduce Dr. Divya Patel. We're going to hear from her right now. She is the Director of Sarcoidosis and ILD programs at the University of Florida, and her focus is to improve clinical care for patients as well as to advocate for them. Dr. Patel, thank you so much for joining us this afternoon to share your expertise in this area. We will talk about the signs and symptoms and the diagnosis as well as the prevalence of this disease in Black women, but let's start with the cause. What is the root cause of sarcoidosis?
Thank you, Adriana. Thank you, everyone, for joining us. Good afternoon. So the cause of sarcoidosis isn't clear, and that makes it even more challenging as a rare disease. We know that it's probably a combination of genetic factors and environmental factors that come together uniquely in each individual person. Some of the environmental factors that have been studied in the past include molds, pesticides, heavy metals. There are certain occupations associated with those types of exposures that have been associated with sarcoidosis. And then in terms of the genetics piece, unfortunately, unlike some other rare diseases, no one single genetic abnormality has been found. So there's been multiple genes, and in each individual person, it may be a different gene that's causing their sarcoidosis. Overall, we do think, that more research is needed to determine the exact relationship between the genetics and the environment. And there is some optimism out there, though. I have to say, recently there was a new research publication that gave us some new light on that. So we're hoping that the researchers and scientists will continue to look into that.
Let's talk now about the signs and the symptoms of this disease, and then we'll talk about why the diagnosis is often delayed. But what are the signs and symptoms that patients experience?
Yeah, so, sarcoidosis can affect any part of the body, so any organ system in the body. And the signs and symptoms really depend on which organ is affected. So I will say, though, that one of the most common symptoms we see patients with is shortness of breath. For example, when they're trying to do physical activity, they feel out of breath, and coughing. The reason that's so common is that about 90% of the time, the lungs are affected. Other very common symptoms, especially in African American women, include skin rashes, eye pain or vision disturbances, heart palpitations, headaches. One other symptom that I like to point out that I think is very poorly misunderstood in sarcoidosis is fatigue. So at the end of the day, feeling like you just don't have the energy to do what you need to do at home. That type of feeling is very common in sarcoidosis. But again, it's challenging because you could have just one organ involved and the symptoms can be different from person to person.
Right. And some of the symptoms that you're talking about, it seems like, okay, you have a breathing issue. How do we know that's not just asthma? Or maybe you're having a vision issue. How do we know that's not something else? How do you kind of link together that this is sarcoidosis? How do you go about diagnosing it?
Yeah, no, that's such a great question. And that is probably the biggest challenge that doctors have. There's no one single test that you can do that says, okay, you have sarcoidosis and another person doesn't. The diagnosis is really made based on the combination of the symptoms you're having, the physical exam findings that you have, the lab tests, the imaging tests like CAT scans and chest x-rays, and then most importantly, a biopsy. Most people, in order to get a diagnosis of sarcoidosis, have to have a biopsy of an organ that's affected. And even still, sometimes it can be challenging because there's a lot of other conditions like infections and cancers that can look like sarcoidosis. So it really comes down to the individual person and the combination of factors that you have. And unfortunately, because there's, like I said, no one single test, that can mean that the diagnosis gets delayed.
Right. So in doing my research on this, I've understood that it can take people years to get a diagnosis, as well as going to multiple clinicians before they actually get an accurate diagnosis. Aside from the signs and symptoms being kind of misleading for some people, do you also find that this is such a rare disease that many doctors are unable to identify it?
Yeah, you're right. So, it is a rare condition, although I feel like, it's out there enough that more doctors should be aware of it. And we are working on efforts for that. So yes, you're right. One of the issues in delay of diagnosis is a lot of doctors don't know about it. We do learn about it in medical school. At least I think most doctors should learn about it in medical school. But if it's rare, doctors don't think of it all the time. It's not at the top of their head as a potential diagnosis. So that can add to the delay.
Let's talk about treatment and cure for sarcoidosis. Is there a treatment for this disease, or are you treating symptoms of the disease?
That's a really great question. So one thing I'll say is in some patients, and some patients are really lucky, the kind of sarcoidosis they have, it can go away on its own, usually within a 2-year period. Wow. Those people are the lucky ones, and unfortunately, Black women are often not in that group. So that's important to know that. But yes, there are treatments for sarcoidosis, and there are people in whom we start treatment and we can put the disease into remission.
Okay.
And what that means is that we can get it to a point where it's not bothering them and it's not going to be harmful to them in the future.
Okay.
Medicines can help with that. The most common medicine that's used are steroid medicines, and the most common steroid medicine is called prednisone in the United States. A lot of the patients you're going to hear from later on today, they'll talk about their love and hate for prednisone because it truly is a love and hate relationship. What I want Black women to know is that steroids are not the only option. Okay. And the reason that's important is steroids have a lot of side effects. So weight gain, osteoporosis, high blood sugars with diabetes, high blood pressure. Those are already things that Black women face difficulty with. So we don't want to add to that problem. And for some women, there are medicines that we call steroid sparing. They're usually used for other rheumatologic conditions like lupus and rheumatoid arthritis. We can repurpose those medicines and use it in sarcoidosis to avoid those side effects. So one of the most common things I see is Black women coming to my clinic saying, I've been on steroids for 5, 10, 15 years. I've had all these problems. And is there anything else that I can take? And the answer is yes. Many times there are other options. So definitely it's important to keep that in mind.
Absolutely. I think that people oftentimes forget that when you're taking medications do have side effects. So for some people, alleviating one problem might create other problems. It might not be as bad, but still it's not, a cure-all. Let's talk about the data. Let's talk about their research and clinical trials. That's really where you're focused. And, you and I were talking in general in this country, Black people, especially Black women, are left out of clinical trials. Is that the case in what you're seeing with this condition?
Absolutely. So, you know, in order to make progress in a disease, in order to find new treatments and to understand a disease, we oftentimes rely on patients to be included in research studies and clinical trials for treatment. In general, not just in this country, but around the world, Black women tend to be left out of these studies. A lot of that, I have to say, has to do with racial bias that is inherent in the medical and research systems. It's there, we know it, and we've studied it in other diseases as well. So currently, a lot of the big studies that have been done, for example, genetic studies that have been done in sarcoidosis include primarily white people, which is okay. It does help us to understand some of the genetic differences in sarcoidosis patients compared to healthy people, but it doesn't help us to understand the disease in Black women. And we know that the disease is different from person to person. So you're absolutely right. One of the reasons that Black women tend to disproportionately get affected by this condition is because we don't study the disease in Black women.
Yeah, absolutely. You know, the numbers in terms of the prevalence of this disease in Black women are actually very staggering. My understanding is that Black women are hospitalized 10 to 18 times more frequently than their white counterparts, twice as many as Black men. Black women die at a rate 12 times their white counterparts and 1.5 times the rate of Black men. What is going on here?
Yeah, you're absolutely right. There's Black women are disproportionately impacted by this disease, much more so than any other group. I wish I could say that we have an answer to that, but honestly, we don't know why that's the case. And again, that goes back to your question about including Black women in research and in clinical trials. One thing that we do know about is that some of the outcomes that Black women have, the poor outcomes that Black women have compared to other groups, are impacted by racial, gender, and socioeconomic barriers to care. Those are things that we don't know all the genetics, but those are things we do know things about. So we know that there's implicit racial and gender barriers due to bias that can lead to dismissal of symptoms. I have many patients who tell me, you know, I've been told for years that I'm crazy and there's nothing wrong with me. But, you know, eventually they get diagnosed with sarcoidosis and that's a relief for them, but it took them years to get to that point. There's also stereotypes of African-American women that can lead to misdiagnosis and late diagnosis. And then overall, there could be poor patient-provider communication. When your doctor doesn't look like you and understand what your life is like, that can make it harder to relate. And to add to that, you know, can be biases and interactions, both historically and experienced that African-American women have had in their life. And that can lead to general mistrust of the healthcare system that negatively impacts how they engage with the system and their providers. I have some patients who've been through so much that, you know, their response to doing more testing or trying a new treatment is coming from a perspective of, well, no one's ever cared before and I've never mattered before, so why should I do this? And again, the last thing I'll say is we know that sarcoidosis is a disease of people with low socioeconomic status. So the lower your socioeconomic status due to income, education, or employment, where you live, whether it's an urban or rural setting, all of those things decrease your access to good care. And that can lead to worse outcomes. So again, we don't know all of the genetic reasons why African-American women have such bad outcomes with sarcoidosis, but we do know that there's societal reasons that could be addressed and should be addressed that could help Black women.
You're absolutely right. And the research on all of that has been done. The studies are out there. And we do know that racial bias plays a role in a lot of outcomes for Black women. And, to your point, Serena Williams had an issue with her pregnancy where she wasn't believed. And this is someone who makes millions of dollars. So it's not even, you can be rich and Black, you can be educated in Black, and it's that racial bias that still becomes a hindrance for Black women getting the health outcomes that they should. What can we do about doctors presenting clinical trials and information to Black women? And you mentioned before that sometimes Black women are just prescribed this steroid, prednisone, for infinity. How can we get doctors to give Black women all the information they need to seek those quality outcomes?
Yeah, so that's, again, such an important question you're asking. And the first thing I would say is that to remember that everyone has biases. No matter how hard we try, it's hard to avoid those biases. So it's important to be self-aware as a physician, to take a personal inventory so that you're addressing your biases so that we can better serve our patients. And some other things that we can do is, look at for me personally, when I see a patient in my clinic, I look at every patient and I think, what are potential ways that we could use this patient's help to understand sarcoidosis better, and to look at their characteristics and see which studies they qualify for. So consider every patient that comes to you, and not just ones that are convenient to you. Also, as providers, we should be informed so that we know about the unique characteristics of sarcoidosis so we can provide quality of care. And we should be an advocate for our patient. The advice I have for patients would be is, knowledge is power. That is the most important thing that I tell my patients. Knowledge is power. Go out there, read about sarcoidosis, learn about sarcoidosis as much as you can, attend forums like this, and go and seek the experts in your community. Sometimes that can be hard if you're in a rural setting or a very urban setting, but there are new ways and opportunities to connect with experts, especially now through telemedicine and through foundations such as the Foundation for Sarcoidosis Research that can connect you to people, not just clinicians, but also other patients who can help provide the knowledge that you need so that you can be your advocate.
And I would also just add on to everything that you say. I'm just nodding my head because I know sometimes it's intimidating for patients to advocate for themselves. But I always say, you know your body and you know the quality of life that you want. So if you see a doctor, and we defer to doctors and clinicians and scientists as the experts, but if you see someone who doesn't make you feel comfortable or feel heard, it's your time, it's your health, it's your copay. Seek out someone else.
Yeah. And, I hate to say this as a doctor because, I don't want to treat my patients as a customer, but think of yourself as a customer. Yes. Would you allow a mechanic or a grocery store clerk to not listen to you or pay attention to your needs? And, seek out people that will listen to you. And I encourage that for my patients. Like, if you're not getting the care and attention that you deserve, find somebody else that will give that to you.
Yeah. You wouldn't go to someone who gave you a bad haircut repeatedly.
Exactly.
So, yeah. Dr. Patel, thank you so much for sharing your insight and your expertise. And thank you for doing the good work that's needed to improve the quality of life for those who are dealing with this disease. Certainly appreciate your time. We're going to talk to now one of the patients that Dr. Patel mentioned, Rhonda Underhill. She is a survivor of neurosarcoidosis and an FSR patient advocate. Rhonda, you were diagnosed in May 2013. Take it away.
Thank you. Good afternoon, everyone. Imagine a woman being engaged and preparing to plan the wedding of her dreams. Imagine that she is preparing to expand her family, but all of a sudden she gets sick while at the same time she gets laid off her job with no active health insurance plan. To make matters worse, the person she thought would support her through all of this decides to leave. Well, that woman is me. and I'm here to tell you my story of perseverance. My name is Rhonda Underhill. I'm a fighter, a thriver, a survivor, but most importantly, I am a believer in the Most High. My flight started in December 2012, in which my health began to rapidly deteriorate out of nowhere. And it was not until May of 2013 that I was formally diagnosed with neurosarcoidosis and hydrocephalus. In my case, it took nearly 6 months for my condition to be confirmed, in which I came very close to death during this time. To help explain my condition, neurosarcoidosis is a form of sarcoidosis, also known as inflammation of the brain, and hydrocephalus is a separate brain condition, also known as water on the brain. Each condition is treated separately, and today I'm here to tell you how the miss, or should I say the delayed diagnosis of neurosarcoidosis drastically impacted my life. Imagine waking up one day and no longer being able to do anything for yourself. Imagine no longer being able to go to the bathroom on your own or having to ask someone to hand you your toothbrush. Imagine having to ask someone to make your plate or pass you your washcloth to wash your face. Imagine no longer being able to grab your lunch bag as you walked out the door for work, or not being able to sit on the couch without the aid of pillows holding you up. Imagine no longer being able to prepare yourself for the day. Well, that is what happened to me. To simply put it, my life went topsy turvy in what seemed to be the blink of an eye. Let me take you back to March of 2013. Despite experiencing some severe symptoms, which included migraines and vomiting blood, along with the spontaneous inability to walk and dizzy spells, I delayed seeking care because I didn't have health insurance and was concerned about the cost. After a few weeks of these symptoms worsening, I finally decided to go to the ER, where I took a series of MRIs and was later transported via an ambulance to Johns Hopkins Hospital in Baltimore, in which I was admitted and kept for 9 days. What started out as a normal day of me not feeling well turned into the day that forever changed my life. During my initial admission, I was diagnosed with having either meningitis or tuberculosis and was placed on 25 different medications to include 25 milligrams of prednisone, or should I say steroids daily, which equates to 175 milligrams of steroids per week, and that's a lot. My treatment plan was aggressive due to the rapid deterioration of my body functions, and the team of neurologists were puzzled by the cause. In what seemed to be a matter of days, I went from driving, walking on my own, and doing for myself to utilizing a walker and a wheelchair to remain mobile. It was during this initial hospital admission that I was told to contact my next of kin and advise them to get here right away because I was going to expire. Imagine hearing those words, "You're going to expire?" Yes, I had symptoms that caused me not to feel well, but I had no idea just how close to death I was. Although the neurologists caring for me were unable to pinpoint what I had, I was eventually discharged with a walker to support my inability to walk alone and was told that therapy, medication, and time would help restore my health. So again, I ask, imagine waking up one day and becoming helpless. After 2 months of being on various medications and going to what seemed to be useless therapy sessions, my condition worsened and I was readmitted to Johns Hopkins for a second stay. It was during this time that I was properly diagnosed by a well renowned neurosurgeon who presented me with two options. Option one was to have brain surgery by implanting a V shunt into the right ventricle that had collapsed due to the inflammation and swelling. This option would mean that I would have to learn how to walk again, and the chances of regaining full mobility was 50-50. Option two was to decline surgery, become crippled and wheelchair bound for the rest of my life, and imagine having to make that decision within the hour. After considering both options, I gave him the green light to operate on me, and here I sit today to share my story. If I'm you, I would ask, what would have happened had neurosarcoidosis been detected sooner? Would brain surgery have been avoided? There are tons of questions that remain, yet I am grateful that I was properly diagnosed and have resumed living a balanced, healthy life. Because of my faith, I know that nothing just happens, and this was all by design. It was during this dark period of my life that I found the Foundation for Sarcoidosis Research and learned that there was a community available to educate and support people like me with this condition. Together, we can improve the quality of care for African American women, as there is certainly a great need to increase the understanding of the risk we face, the importance of early detection, and the need for better disease management within our community. Together, let's continue to raise sarcoidosis awareness, educate others, and and advocate on how this illness has impacted African American women. Thank you for your time, and I hope that my story inspires you. Please listen closely to my next two sarcoidosis sisters who will also share how their diagnosis forever changed their lives and why they are here today. Thank you.
Certainly inspirational, Rhonda, and definitely see your
Mm,
perseverance. I do, before we let you go, I want to ask you, how
mhm.
are things for you today? Are you still on medication? You mentioned that the surgery might mean 50-50 chance of mobility. Where are you now?
I am doing fabulous. I have no complaints, and I am grateful for every day that my feet hit the ground and I can walk on my own. I am on medication, and unfortunately, I did develop type 2 diabetes as a result of the
Mm.
prednisone, but that is controlled. I've actually lost quite a few pounds, got a few more to go, but I'm living a healthy, balanced life, and I'm forever grateful for everyone who provided care, including my family and extended friends.
Since learning of your diagnosis, have you been able to talk to other people and find out that it's a bit more prevalent than you expected, or do you still find it to be fairly rare in your circle?
I won't say it's fair. It's rare. Actually, quite a few of my relatives have
Mm,
sarcoidosis or had experiences with meningitis.
mm,
So it's not as rare as we were thinking. But
mhm.
what's interesting is that more and more people around me who share the same blood as me actually have the disease. So I would say that there is something there when it comes to genetics.
Mhm. Last question for you. For
Yes.
those who are watching and listening, and maybe they're just now getting their diagnosis and starting their journey, maybe they're feeling a little bit down about life ahead for them. What words of encouragement? Yeah, you're shaking your head because I'm sure you can relate. What words of encouragement would you share with them?
Don't give up
Mhm,
and believe in the higher power because
mhm,
he is real. There were many of days during this period of my life when I was questioning, was he around?
mm.
And he just spoke to my spirit and said, just trust me. And I did. And here I stand today to share my story.
Rhonda Underhill, thank you so much for sharing your story of inspiration, of hope, of
Mhm.
perseverance. Certainly touching. Thank you for your time. I do
You're
want to
welcome.
bring on one of your
Thank you.
sarcoidosis sisters, Jessica Reed, a registered nurse, an 18-year neurosarcoidosis survivor. Jessica? Jessica, it seems like we might be having some audio issues. I'm not sure if you're muted.
Is that good?
There we go.
Thank you, Adriana. I'm so sorry about that. Good afternoon, everyone. My name is Jessica Reed, and I am here today on behalf of the Foundation for Sarcoidosis Research. I proudly serve as a patient advocate and navigator and member of the Speakers Bureau and Women of Color Patient Advisory Committee. I am going to walk you through my sarcoidosis journey, highlighting my spirit of resiliency and share some astounding statistics on how sarcoidosis impacts African American women at a higher rate than other patients with sarcoidosis. As a vibrant sophomore college student, I never thought twice about my health. My attention was focused on living the dream, so to speak, working diligently to graduate early as a physical therapy student, and dating the love of my life, who is my husband today. However, I began to experience severe low back pain, which caused me to believe that something was wrong because I had never felt that before. My nurse practitioner thought I pulled a back muscle since I was so very active and ran a lot around campus in my leisure. You see, up until high school graduation, I participated in 3 sports: volleyball, basketball, and track, and I was also a dancer. Due to the pain, I was not able to lie down to sleep in my bed, but instead I had to sleep sitting upright with my back against the footboard. After taking Flexeril and a few days off from running, the pain seemed to have subsided. But even having the pain return off and on for some time thereafter, I just brushed it off by taking some pain relievers in order to keep going. I mean, I was an avid runner and didn't think it was anything serious. Fast forward, I decided to take some time away from college after welcoming our first child, Erica, and getting married. About 3 months after our daughter was born, the back pain returned, but was much worse than the first time around. This time, the pain started in my lower back, radiated down my buttocks and the front of my thighs. From my knees down to my feet, all I could feel was numbness and a tingling sensation. Along with these symptoms, I had to strain to urinate and have a bowel movement, which was very frightening and frustrating. As a matter of fact, on the night of our wedding, I was in the ER and had an MRI performed. So much for our honeymoon. I vividly recall getting a call the following morning, and I was told the MRI showed a tumor on my lower spine. Immediately, the first thought that came to my mind was the C word. And then I was met with a socioeconomic barrier. Due to being underinsured, it took almost 2 months before I was able to be seen by a specialist, a neurosurgeon, and the drive there was 2 hours. I was referred to Duke University Medical Center, and on May 20th, 2003, I underwent a laminectomy or back surgery. The neurosurgeon told my family the tumor was a lymphoma, and my heart sank. I had to lie completely still on my back in the ICU for 24 hours. I could not sleep that night because all I could think about was after being married less than 2 months, my husband would soon be a widower, and our baby girl would not get a chance to know her mother. The providers ordered so many tests and exams that I felt like a lab rat with no answers to explain my symptoms. The worst procedure I underwent was a bone marrow biopsy, which gave no answers either. With no clear diagnosis, the providers still proceeded to transfer me to the oncology unit, and I remained hospitalized for 6 days total. On the 6th day, I was discharged with a diagnosis of tuberculosis after the providers reviewed the gram stains. I completed the course of TB treatment and began running again once my neurosurgeon cleared me because we both thought I was cured, not to mention how young I was. However, on the next day, after running only 1 mile, I woke up with that familiar, excruciating back pain and immediately phoned my neurosurgeon. That is when he referred me to rheumatology. I had a bronchoscopy done due to the small lung nodules noted on my chest x-ray, and it confirmed sarcoidosis. I thought to myself, finally a diagnosis. But wait, what is sarcoidosis? After asking questions, the only 2 words I heard the rheumatologist say was no cure. I was placed on a high dose of prednisone, and in a few months, I felt like myself again, and I was weaned off the steroids. My life felt normal. I enrolled back in college and completed my Bachelor of Science in Nursing degree. In August of my senior year of nursing school, I gave birth to our son, Eric Jr. Almost 3 months later, I had a grand mal seizure for the first time while sitting in the main lobby of Duke University Medical Center. I was there because my father had a benign brain tumor scheduled for removal the next day. I took a week off from nursing school to support and help my mother care for him, but I had no idea I was only preparing myself to be hospitalized for sarcoidosis in my brain. But God knew. Yes, ironically, my father and I were in the same hospital at the same time on the same floor, but in 2 separate units. I was placed on a daily dose of 60 milligrams of prednisone for almost 2 years, and I experienced more than 10 side effects during that time. They took such physical, emotional, and mental tolls on me that I was not able to care for our 2 children. I was left to depend on my husband and other family members to care for them and me. I became very depressed and found it hard to even look at myself in the mirror. As a result of sarcoidosis being more aggressive the second time around, to this day, I have to empty my bladder every 2 hours with a catheter. The extent of the changes in my bodily functions, short and long-term memory loss, and a limp when I walk, caused me to stop my medications 5 times. It all became too much to bear for a 27-year-old woman whose mind and body felt like that of a woman twice or triple her age. After the 5th time of stopping my meds and my husband telling me how my neurologist was disappointed in not following my treatment plan, I made a conscious decision to take my power back from sarcoidosis and fight daily. I was weaned off prednisone again, and my neurologist replaced it with Cellcipt. Since 2007, I take Cellcipt and Keppra daily and will indefinitely per my neurologist. Despite the physical limitations I currently live with on a daily basis, I refuse to allow it to cause any mental limitations. You see, over the course of living with neurosarcoidosis for 18 years, I have completed not only my Bachelor of Science in Nursing degree, but also my Master of Science in Nursing degree as a family nurse practitioner. However, I cannot help but wonder what my treatment plan and quality of life would look like today if my symptoms and pain were taken more seriously up front. Would I have received a quicker confirmed diagnosis if the referral to neurosurgery would have been placed 2 months sooner, despite being underinsured? This is how I know how crucial it is for us to have this important discussion here today. African American women have more severe and chronic forms of sarcoidosis, higher rates of hospitalization, higher prevalence of depression, and a higher mortality rate. That mortality rate is 12 to 14 times higher than whites and 1.5 times higher than African American males. We can improve how African American women are cared for by raising awareness of the disease and its impact regarding barriers to high quality care. As a community, we need to do better about speaking openly about our health issues, and we need to call them out by name. Grandma does not have the sugar. It's not heart problems or breathing problems. It is diabetes. It is coronary artery disease. It is interstitial lung disease. It is sarcoidosis. It's important that we specifically call these diseases by their names. Without naming the disease, how can we effectively advocate for each other? How can we raise awareness? How can we learn the symptoms, risk, or even how to treat it? I knew someone who passed away at 53 years young, and I did not find out it was sarcoidosis until years later. Imagine if I, someone living with sarcoidosis, had known she had the same diagnosis. I could have connected her with resources, support, education, and who knows what that impact could have had on her treatment and outcomes. Whether you have the disease or not, you can always help advocate and share information. If you are an African American woman without sarcoidosis, I urge you to know it does exist. Know the signs and what to look for so you can help educate those who do not know, and please encourage them to visit the FSR website at stopsarcoidosis.org. And if you think you have sarcoidosis or have had trouble diagnosing the source of ongoing health issues, visit the website to learn about the different forms of sarcoidosis and how to have the discussion with your provider. Be knowledgeable about the disease so you are empowered to support not only us, but your friends, family members, or colleagues with the disease. Thank you for your time and attention.
Jessica, I am so proud of you, I would say, for your daily determination to take your power back from this disease. We only have a minute left of your time, but I know that you're a registered nurse and you powered through and got your master's in dealing with this. I just want you to give a few words of encouragement for anyone who's watching and dealing with this. What is the determination? What's your sustenance every day?
My sustenance every day is to find that one thing that brings me joy. Mm-hmm. Find that thing that lifts my mood, that mm-hmm. helps me feel better. And that thing for me is spending time with my family. Mm-hmm. It is working out. It helps relieve all the stress. It mm-hmm. helps me laugh. It helps all the bad things go away. And when you find those things, hold on to them. Look forward to experiencing them every day, as I do.
Absolutely. Jessica, thank you so much for sharing your story and being brave enough to do so. It's certainly appreciated. I want to bring on our last patient for this webinar. That is Cheryl Bradford, who was diagnosed with pulmonary sarcoidosis back in 2001. Cheryl?
Thank you so much. Hi, my name is Cheryl. I grew up in Queens, New York, the youngest of 6 kids. My block was the coolest in the neighborhood, the coolest kids and the coolest teenagers. On Saturday mornings, I would wake up to the sound of jazz music playing throughout the house. That was my father's favorite kind of music. My mom was the big mama of the neighborhood. She was from Bermuda. She believed in the power of prayer. She always trusted in God. One of our traditions is putting the kettle on, meaning that we never needed an excuse to make tea. In our family, tea would solve anything, whether you were sick, hurt, or sad. Mommy would pray for you and give you tea, and everything would be okay. I wish life was still that easy. In my adult years, I worked at the Department of Education District Office in the business department. That is where I was when I first got sick. I was married, raising my young daughter and taking classes towards my BA in business administration. I was getting ready for church one morning and I started feeling sick. It felt like someone just peeled the skin off my entire body and was poking me with pins. I went to church anyway, but afterwards, I went to my parents' house. We called the doctor who told us to go to the hospital. There, I had a fever of 104. I was having a difficult time breathing, so the doctor took a lung biopsy, and there it was. I was diagnosed with sarcoidosis. Sarcoidosis? What is that? What are the symptoms? How did I get it? And is there a cure? The hospital doctors didn't really explain my condition to me. I had to do a lot of my own research, but it still wasn't the kind of information I know now. It really didn't hit me how sick I was. Within a month or 2, I recovered. So in my mind, I was better. So I got on with my life. Little did I know my condition was getting worse. Years later, I started having a chronic cough and chest pain, but I had trouble getting a pulmonologist to take it seriously. I was told by one pulmonologist that the pain was in my head. Another pulmonologist asked if I thought it could be a sinus drip. When I could not get a specialist to help me, I tried to get rid of the chronic cough and the chest pain on my own with over-the-counter medicines. My condition was getting worse, but I had no clue. Eventually, I found a pulmonologist who took this a little further. He sent me for a chest x-ray and asked me to come in to discuss the results. I was excited because I thought I finally found a pulmonologist who could help me. Boy, was I wrong. He showed me the x-ray of my lungs and explained to me in medical terms what was going on. I was so confused. I didn't understand anything he said. When I told him I didn't understand, he didn't clarify anything. He just asked me if I still was in pain. I told him no, and he said he would not do anything if I'm not in pain. Once again, I was denied access to proper care. I had no idea that I needed medical attention. I had no idea that sarcoidosis was taking over my lungs. My life went on. I never went back to see him again. I decided to just deal with the cough, but that wasn't as easy as I thought. Later that year, I went to North Carolina to spend Christmas with my daughter. Excuse me. We was about to go to church for New Year's Eve when all of a sudden I started coughing up blood. I was hunched over the toilet and there was just all this blood. My mother and my older sister, Andrea, were there and they tried to get me to go to the emergency. I refused to go to the hospital. So instead, the 3 of us got in a car and drove all the way back to New York. It definitely was not how I planned to ring in the new year. I still can't believe I did that. By the time I got home, the bleeding had stopped. So I thought I was okay and I went on with my life. Over time, my cough seemed to calm down and I thought I was okay. But then I would have another bad episode and cough up blood again. doctors after doctors after doctors, and no one could treat my condition. This pattern repeated for 2 years. I did not realize I had never been told that my condition was grave. I had another episode early in the morning of January 12, 2013. This time I coughed and coughed and coughed until I passed out. I woke up in a pool of blood with a split lip and a missing tooth. I looked in the mirror and it almost didn't register. I kept thinking, I can't go to work like this. My tooth is missing. My sister Vera rushed over and took one look at me and said, I needed to go to the hospital now. I was in the hospital for 45 days. Most of the time there was spent in the ICU. My condition was grave, and the doctors told my family I was not going to make it. Through determination, prayer, support of my family and friends, I pulled through. The surgeons started suggesting a double lung transplant, as both my lungs now had such severe damage. There was holes throughout my lungs, as well as several fungal balls in them. At this point, I had to start advocating for myself. It was a stressful journey. I did more research and befriended people with sarcoidosis through the Foundation of Sarcoidosis Research and heard the same stories from African American females concerning the lack of medical attention and clear explanation of their condition. Statistics shows that sarcoidosis impacts African American women more than any other groups. They have more severe and chronic forms of sarcoidosis, higher rates of hospitalization, and higher mortality rate. Was it because of our skin color that these doctors was not taking us or our illness seriously? I was stressed, and my condition got worse, all because I could not get the proper care that I deserved. I was coughing up blood, had shortness of breath, chest pain, and often felt fatigue. The lack of care was taking a toll on me, and I felt helpless of the fact that sarcoidosis was taking over my lungs and body. This became a burden. I have experienced lack of proper medical help for 10 years, and it almost cost me my life. As an African American woman living with sarcoidosis, I needed to do something. So I became a part of the FSR Women of Color campaign to raise awareness for the prevalence of this inflammatory disease in African American women and to help address these disparities. Finally, after years of seeing several pulmonologists, I found one who specialized in sarcoidosis. He educated me on what sarcoidosis is, the symptoms, and the treatment. Together, we eventually settled on a treatment plan that was a good fit for me. He is still my doctor today. That is why I'm here to ask you to join me in addressing disparities in healthcare and minorities face. There are things that each and every one of us can do. African American women with sarcoidosis, advocate for yourself and others. Ask questions. Be prepared. Be an active part of your treatment plan. Get smart about sarcoidosis. Knowledge is the power. Visit the FSR website to learn more about sarcoidosis. African American women without sarcoidosis know it exists, know the signs, and know what to look for so you can help educate those who do not know and encourage them to visit the FSR website to learn more about sarcoidosis. And if there's any doctors out there, doctors, educate your patients about their condition. This can eliminate a good amount of anxiety patients may have due to the lack of education about their condition. This can be a start of building trust with the healthcare system, and minorities. Remember, always keep the patient's best interests at heart. Thank you for allowing me to tell my story.
Thank you so much for sharing your story. You know, I appreciate everything you said about doctors talking to their patients, because really it plays into the fact that Black women are not listened to and we are not heard. And again, research and studies show that's true. Cheryl, you co-founded an organization called Stronger Than Sarcoidosis.
Yes.
Briefly, we only have about 30 seconds. Where can people go to find out more information about this organization that you created?
Okay, they can go to strongerthansarcoidosis.org.
All right. Cheryl, thank you so much. Cheryl, Rhonda, Jessica, thank the three of you so much for being so brave and sharing your stories of perseverance, resilience, hope, and inspiration. It is truly, truly appreciated. Well, before we wrap things up, I just want to say, empathy goes a long way. It allows us to give people grace because we really never truly know what they're going through. Knowledge is power. We've said that repeatedly during this webinar. But the next time you hear policymakers talk about research funding and clinical trials and data and health outcomes, especially for Black women, I want you to remember the stories that the women here shared with you today. Put their faces, put their stories to these policymakers and lawmakers and hold them accountable to make sure that we all have equal health outcomes and superior quality of life. Be an advocate, even if it's not something that you're personally going through. Thank you so much for your time this afternoon, for sharing an hour of your time with us here, discussing this very important topic. Even though it is a rare disease, remember, the impact on quality of life is great. I'm Adriana Hopkins, and you all have a great rest of your day.